Good morning, everyone. It's great to be here this morning. This is the fourth year that I think the Irish Heart Foundation have been invited to the EPA conference, and I think it's really important that the likes of ourselves, the Asthma Society, are here to kind of put the health message forward, because I think when it comes to driving public and political change, having the kind of health message out there, particularly from NGOs like ourselves and the Asthma Society, who have no vested interest but to improve healthcare for the lives of Ireland, I think it's really important. So I'll just give you a quick overview of some of the work that we've been doing on campaigns and alliances for cleaner, healthier air. Just kick off first, just to kind of talk about who we are. The Irish Heart Foundation, we are the national stroke and heart charity fighting to protect the cardiovascular health of everyone in Ireland. And we work across a range of areas, campaign and advocacy, which is the area that I sit in, innovating and leading in health promotion and prevention, obviously because prevention, 80% of cardiovascular diseases can't be prevented, so that's a key part of our work. Building a nation of lifesavers through CPR training, a huge part of our work, particularly teaching students in schools the life-saving skill of CPR. That's a huge part of our work. And of course, caring for the 600,000 people in the community living with stroke and heart conditions, and there's probably people here today or family members of people here today with some kind of cardiovascular condition. So it is a huge issue. But for today, I'm going to be talking about some of the campaigning and advocacy work that we do. And a lot of the work that we do is around preventative health, because obviously preventative health is the most effective way of and the most cheapest form of medicine, preventing people from having cardiovascular conditions in the first place. So we work large areas of children's health, particularly on reducing childhood obesity, better services and supports for cardiovascular patients. Of course, tobacco and nicotine addiction, particularly with the rise of e-cigarettes and nicotine pouches. Poor diet and consumption of ultra-processed foods, and there was a big report out in the Lancet this week of the impact of ultra-processed food on health outcomes. Active travel is also a big thing, obviously, for physical health and cardiovascular health, which obviously does have a link to air quality, which I'll be talking about today. But I suppose in the past few years, I've been with the Heart Foundation about 7 years now, and when I first started out, we didn't really do much work in environmental health, but more and more we've had to move into this space, whether it might be noise pollution, heat, but specifically air pollution. And the reason why we've kind of had to get into that area is because the science is pretty clear, the science is overwhelming, and the science keeps coming that exposure to air pollution is linked to the exacerbation of all major cardiovascular conditions. And we know when it comes to the likes of PM2.5, one of the most health-harming pollutants out there, that when it's inhaled deep into your lungs, it can actually pass from your lungs into your bloodstream. And once it's in your bloodstream, it affects your circulatory system, your cardiovascular system, and pretty much nearly every organ in the body as well. So, and we do know from science that the majority of deaths from air pollution are due to heart disease and stroke. So we had to move into this area because the science was pretty overwhelmingly clear. So some of the work that we've been doing for cleaner air for the past several years, one of the big things that we did was we actually did a joint campaign with Anna in the Asthma Society back in 2022, with the likes of many people here, many civil servants, and many the likes of EPA, working to pass the solid fuel regulations. So we did a big kind of lobbying campaign ourselves on asthma, because often we have no vested interest. We are not a semi-state. We can lobby, and that's kind of one of the key aims of our work. So that was a great campaign. We work closely with our British counterparts up north, the British Heart Foundation Northern Ireland, as air pollution is an all-Ireland issue, doesn't respect borders. There's already been a mention today about air pollution up in Northern Ireland and some of the lack of alignment in terms of some jurisdictions. So we do a lot of work with them, and we released a report in 2023 on air pollution and mortality on the island of Ireland, and that was with Pat's team and TU Dublin and Queen's University Belfast. We were co-founders of the Climate and Health Alliance in 2019, which I'll talk about later. And some of the work that I'll just talk on briefly now is, for the past few years, or the year or two, we've been working with DEC, who now, I believe, a different acronym, to develop a public awareness material on two core campaigns, solid fuel burning, which has been mentioned a lot here today, and engine idling. But today I'll be talking about the solid fuel awareness campaign that we've been working on. And I'm conscious that I talked about this campaign last year, but just with capacity and timelines, it took a while to get it out. So with the support from DEC and the Government of Ireland, we prepared a range of assets that sought to raise awareness of the health harms of solid fuel burning, and particularly raise awareness of it without scaremongering, because we know in Ireland there is a huge issue of energy poverty. More people, I think it's about 29% of households experience energy poverty. So energy poverty is a huge issue, and so we have to try and navigate that tricky balance of informing the public without scaremongering. But that doesn't mean we can't tackle energy poverty and poor air pollution at the same time. And of course, we know that there is the huge cultural attachment in Ireland to a fireplace or a wood-burning stove. So very much when you work in this area, I am the killjoy within my family, telling people not to light the fireplace. So I'd say that many people here feel the same thing. So we talked about this. I talked about this last year, but I'm delighted to say now the assets are now live on our website, and very much they're there to be used by local authorities, businesses, members of the public to raise awareness of this issue. And this is the concept that we went for. Will I light a fire? And very much, since we're trying to navigate that tricky balance of not targeting people who rely on solid fuel use to heat their homes, who are truly in energy poverty, but targeting households, many households, like probably my family household, those households that choose to light a fireplace more for atmospheric purposes, more for just because it's a dark evenings. It might not even be that cold, but it's just to get the question out there. So the concept sought to place the question in the mind of the reader. Do you really need to light the fire? Can you go without it? Like, before you light that fire, ask yourself the burning question: is it really necessary? So this is one of the concepts we went with. Obviously, this concept we're kind of leading on is the rural image. It's a father with his two daughters out in a kind of rural village, because obviously we know that in our urban areas or cities there is poor air quality, but some of the worst air quality we have is in our large towns and villages, which rely heavily on solid fuel burning. So that's the kind of area that we are trying to target primarily. But we have different settings. So we also have settings of an urban and rural, and of course families and businesses, because obviously we want to put that question in the mind of a mother, a father, or grandmother, or a son or a daughter who has their grandparents over, or a business owner, because also we know many pubs, many hotels, they light the fireplace for that atmospheric purposes more than for kind of a heating purposes. So it's kind of putting that question in the mind of the reader. And we also have infographics and FAQs that pretty much lay out all the evidence as well. Again, putting the evidence out there, putting the health information out there without trying to scaremonger. So it's a tricky balance. I'm sure not everyone will agree with the approach we're going for. It is a difficult, contentious topic in Ireland, but we feel we need to try tackle air pollution, the use of solid fuel burning, and also energy poverty at the same time. It's a tricky balance, but I think we can do it. And I'm delighted to say it's now available on irishheart.ie on our website. So we have various different assets to be used. And again, we would encourage as many businesses, local authorities. I have a QR code next, so if people want to use that to find. The assets are available to download from our website. Again, open to the public, local authorities, businesses, members of the public. We already have a few members of the public who have downloaded these assets and have put them up on community centres around their areas. And very much I'm looking to get like even just anecdotal evidence from their area, and certainly it's starting a conversation, but I suppose it's the difficulty is actually getting to that decision where that people will actually choose not to light the fireplace unless it's really necessary. So that's some of the work we've been doing on the solid fuel burning, and then I'm going to give a quick overview of some of the alliance work we've been doing on clean air. So as was mentioned earlier, the Climate Headlines, which was co-founded by the Irish Heart Foundation and a number of other organisations, including the Asthma Society of Ireland. It was established in 2019. We are an all-island coalition campaigning for climate action to protect and benefit public health. Often when you talk about climate change, a lot of people, members of the public, think of emissions and the environmental aspect, even though addressing climate action, but also the effects of climate action are going to be so devastating on our health. We have 33 organisations from across the island of Ireland, and that's up from 25 since last year, so that's been great. So what's been clear is these are all the logos of our members. Again, lots of household names there, between the Royal Colleges, Bohemians Football Club, Asthma Society, the Irish Heart Foundation, Irish Cancer Society. And I think that's really important when you're talking to politicians, because we are a lobbying organisation. When you're talking to councillors, politicians, ministers, TDs, senators, when they see all these logos together, there is a strength in the collective voice of all these organisations. Having the health sector there, singing off the same hymn sheet is really important. And we work across kind of 5 key areas: sustainable diets, the biodiversity crisis, healthcare sector mitigation, but 2 key areas that we've been working on in the past year, which are linked to this topic today, is active travel and air quality. So for about 18 months now, we've had two working groups developing reports on active travel, which was launched just last month in the Mansion House, and air quality, which Ian is actually part of the working group, and there might be 1 or 2 other, and Clara in the back, who are part of the air quality working group. And we're hoping to launch that in either December 2025 or January 2026. And both reports really highlight the health impact and benefit of active travel and clean air. Obviously, it would make more sense if I could talk about the clean air working group today. The report if it's published, but unfortunately not published just yet. But the active travel does have a link to clean air, and obviously it's very important. So this is a report we launched just last month, Active Travel, the Magic Pill. And when we're talking about active travel in this report, it's very much talking about walking, wheeling, cycling, and even public transport. Because even walking to your bus, walking to your loo, walking to your train, which I appreciate, public transport is not in the most ideal circumstances in Ireland, but that has a huge impact in just getting that active travel level in there. And I think it's really important that we emphasize that we can't just electrify our entire current transport system, because we have such a overemphasis on private fossil car use. I think there's a need to move towards more active travel levels, because we have a sedentary, quite unhealthy population as well. To get people more walking, cycling, taking public transport to work, to the office or to school, kind of especially for that next generation. And one of the things that we really talked about in that report was transport policy is health policy. And I think even for the purpose of this conference today, I think it's really important to say that environmental policy is health policy, housing policy is health policy, giving people safe, sustainable, warm housing is really important. And the same when it comes to environmental policy and air quality policy, because it has such a big impact on our lives. And so the report really focused on how do we get there, and was crucial about the report. The report didn't really make any new recommendations of we need new strategies or new policies, because we have a lot of good policies out there, including the clean air strategy. But what was really important was that there needs to be better coordination and overarching governance, a rebalancing of resources, because obviously we know in Ireland when it comes, just because you have a great policy, if there's no money behind it, then it won't actually get anywhere. So that was really important. And of course, addressing the links between land use and transport planning, and communicating the positives of active travel, I think is really important to the public. And when it comes to this report, movement is medicine, but I think it's really important to say that clean air is also medicine, and that's something that was touched upon by Ian as well. And I'm on the last minute of my slide, so I'll go through this quickly. This was the launch of a report last month. I think it's really important that we got some great media coverage. So the media is interested in this area, and what's most important is that we have a lobbying plan underway to meet and present with relevant TDs, senators and committees, because I think that's where decisions get made. And we already have a plan in place to meet with the NTA, and one of our colleagues presented a report at the Dublin City Council Special Mobility Forum. And then I'm on to just the last slide. And of course, it would be remiss of me not to talk about our next report, all about air quality. And obviously, it would be more timely if we had the air quality paper out now. I could talk about it, but this is a sneak preview of the work that we'll be doing on air quality. And again, it's a lobbying paper, lobbying for cleaner air to benefit public health. And hopefully, when it's out, we can circulate amongst everyone here. So that's me a few seconds over, and these are links to reports as well. So I'll leave that up for now, and thank you very much.